Good morning, students. So today we are going to see about regarding DOTS, directly observed treatment shortcuts. Treatment regimen in TB is very important and it is very effective and successful treatment modality in curing TB if the medicine is taken on regular basis. So in detail we'll see about DOTS treatment. Now presently we have fixed dose combination. In the last class I hope you are remembering about old regimen, how weekly basis, twice in a week, thrice in a week. In that way the medicines was taken by the TB victims. Now presently there is a change because a long duration of time the patient has to take on the medications, thereby regulation or regular intake of medicine is not happening, thereby their chances of skipping of medicines are more, and finally they are landing up with drug resistant TB, multi-drug resistant. So to prevent that we have started this fixed dose combination. So here it is a daily regimen, so the patient will not get confusion whether I have to take today or yesterday, whether I have taken, I am not remembering. So these kind of issues will not happen. It is compulsory that on daily basis they have to take, so they will not have a confusion and the chances of skipping the medicine also will be very less, and there will not be an overdose of medicines. All the medicines are combined together in a single tablet, and that is called as fixed dose combination. And it is a package of several new things. Among those, fixed dose combination is only one single component. In one tablet, all these medicines are being combined together into single tablet. So overall medications will not be there, and patient will be comfortable in taking that. Advantages of this fixed dose combination is it is a simple dosage, safe and effective. It increases the efficiency, improve patient adherence because it is daily being taken, so the patient will not, chances of skipping will be very less, skipping of the drugs will be very less. Improves the treatment outcomes, low cost, more economic than single ingredient drugs, reduced pill burden, reduced use of monotherapy, lower risk of misuse of single drugs, lower risk of emergence of drug resistance, easier to adjust dosages by body weight, fewer tablets to handle, hence the quick supervision by the DOTS provider, easier drug management. So lot of advantages are there compared to previous regimen. So that's how this new regimen seems to be very successful in curing the TB victims. There are still disadvantages too. Multi-ingredients in a FDC can confuse the physician who may not remember the exact composition and dose of the individual active ingredient in a particular FDC. That is the only thing that for that training is being given for the physicians and dose provider, because the doctor must be very much clear about the combination and the dosage that is being included in a single drug. If the physician is not thorough, then there is a chances of confusion in FDC. For that, to prevent that confusion, the physicians and medical health workers are being given training regarding FDC for TB treatment. If one drug is contradicted for a patient, all FDC cannot be prescribed. Okay, that is one disadvantage. If any of that drug, it includes 4 to 5 drugs in single tablet, so any one drug is contraindicated or the patient seems to be allergic to that, then we will not be able to provide FDC. Instead of that, we can provide single tablets. Expecting more adverse reactions, strict supervision is needed, because it is giving under all these medicines are given in a single tablet. Commonly there are chances of few side effects for these medicines, all TB medicines, because it is a very high dose medicines, so a minor amount of side effects do expect for these medicines. So as it is given in a single tablet, these adverse reactions can be there, so strict monitoring must be done once the patient is with these new type of medications. Modification is needed if needed from loose drugs. So instead of providing these loose drugs and making a pill burden, this method is better. Modify it in a better way and make this FDC more convenient for the usage of TB affected patients. Now let us see how much is the dosage. So intermittent regimen dosage for 7 days per tablet. So one tablet include all the medicines, and these 7 tablets per day it is being provided. So the combination or the dosage of the medicine is that isoniazid 600 mg, rifampicin 450 mg, ethambutol 1200 mg, pyrazinamide 1500 mg, streptomycin 0.775 gram. It is an injection. So these are the medicines that is being provided as 2 tab, 1 tab, 2 tabs in pyrazinamide. In that way it was given in the old regimen. Now it is being completely changed. You can see here, previously you see how thrice in a week or twice in a week, Monday, Wednesday, Friday, in that way it was provided, and patient may get confused. Now it is a daily regimen, so every day the patient has to take the medicine. So now we are in a new stage of FDC. Frequency of dosage, that is daily 7 days per week. So 7 tablets in a week. So in that way it is easily to be make the patient understand also. Simple daily dose, no extension of intensive phase. So we don't have extension of intensive phase. 4 weeks per month, that is 28 days it is being provided. Injection streptomycin daily, including Sunday, only 8 Sundays. So injection is being provided in the form of a tablets also in case of severity, and it is being provided only 8 Sundays, and no mid continuation phase follow-up. So in between the continuation phase we have follow-up in intermittent phase. Now in daily regimen system we don't have that follow-up. Medicines are based on the weight bands. In adult we have 4 weight bands. In pediatrics also there is a weight band. Accordingly the tablet dose is being confirmed. Follow-up even after the treatment of 2 years. So after that also the patient can have the follow-up. Family dogs, if needed, can be provided. If the family member can be, the dogs provided in following the TB treatment. Next is treatment of tuberculosis. Fixed dose combination drugs for TB under daily regimen are packed to cover 4 weeks of treatment. So 28 days, that means 28 tablets. It would be expensed on daily basis. Thus the effective number of doses the patient would be receiving in a month would be 20. Simple to understand. So basic formulation of single capsule. So this is the capsule formulation, that is isoniazid 75 mg, rifampicin 50 mg, pyrazinamide 400 mg, ethambutol 270 mg. So all these doses combined together in a single capsule. So here you can see weight band. So these are the 4 weight bands for an adult, that is 25 to 39, 40 to 54, 55 to 69, and above 70 kg. So in that we have usually intensive phase and continuation phase. So in case the patient is with 25 to 39 kg, the patient has to take 2 tablet. Combination is the same, that is 75, 150, 400 and 275 mg per tab. And in that way, in that 2 tablets, a single capsule consists of these many dosages, and for 25 to 39 kg the patient has to take 2 tablets. As the weight band increases, the tablet number also increases. Second weight band 3 tablets, third weight band 4 tablets. Above 70 weight, the patient has to take 5 tablets in intensive phase. Similarly, in continuation phase there is a change in the combination of the drugs. You can see only isoniazid, rifampicin and ethambutol. We don't have pyrazinamide in continuation phase. And you can see the dosages 75 mg, 150 mg, 275 mg, a combination of single capsule. So first weight band has to take 2 tablets in combination phase. Second weight band has to take 3 tablets. Third weight band 4 tablets. Above 70 they have to take 5 tablets. And in first 8 Sundays they have to take the injection. So for that they can go to the